very large percentage of my work involves managing a patient returning back to the workplace. Obviously, I've got to understand what their injury is and the impact that will have on their work. But it's also important to understand the work itself. A worksite visit often helps to see the work environment, the workstation, but also the intangible stuff, the relationship with their line managers, the relationship with their other workers. Do they have a return to work plan that they're going to adhere to? Once I've visited the workplace, I may communicate with the employer, a union representative, or perhaps members of the patient's families to understand what their expectations are and what are the opportunities to get the individual worker back to work. I often negotiate with all the parties involved to set up a graduated return to work plan. So you start off with a couple of hours a day, maybe doing alternative duties, perhaps doing a clerical role rather than doing the manufacturing role. Sometimes that's not possible. A patient may not have the capacity to return to work. They may not have the transferable skills to work in a different part of the factory. They may not have the qualifications. And at that point, to negotiate, to try and arrange retraining, maybe on the job, or maybe retraining outside the work, in order to give them the best chance of getting back to work.